Hello, I'm Heather Walke with DentistryIQ.com. This week we'll be talking with Cynthia Durley, the Executive Director of Danby, who explains why the Dell Foundation will benefit dental assistants. Also, RDH eVillage will be publishing the results of a survey of dental assistants about instrument sharpening, and we are sharing some of the results with you today. We also have a special guest here in the studio with us today. Dr. Joe Massad will be discussing his column in the September issue of Dental Economics with us. The Dental Assisting National Board, or Danby as it is more widely known, has been hard at work recently on a continuing education product for dental assistants and office managers. Known as the Dale Foundation, this project is the culmination of months of work by Danby. Cynthia Durley, Executive Director for Danby and the Dale Foundation, recently explained the exact purpose of the Dale Foundation.
Well, Kevin, thank you for asking that question. The Dale Foundation was formed, it's a nonprofit organization formed to benefit the public, to provide quality, interactive, continuing dental education, to also to provide sound research to promote oral health.
Durley also went on to say why she feels the launch of the Dale Foundation comes at such a great time for dental assistants.
Actually, the Dale Foundation was formed for a variety of types of dental auxiliaries, but in terms of dental assistants, today is a real exciting time for dental assisting. Just across the country, there are so many things happening, so many areas of expansion for their duties, and the Dale Foundation is going to be providing, and currently provides actually, some opportunities to participate in interactive online learning 24/7, to provide information about how to prepare for Danby exams or state-specific examinations, and how to practice. There's some practice opportunities. We've got an online glossary and online practice tests right now for the radiation health and safety exam, but soon for infection control as well. And there will soon be mobile apps for those study aids.
To learn more about the Dale Foundation, log on to www.dalefoundation.org or go to www.youtube.com/Dale Foundation. RDH eVillage, a twice-monthly e-newsletter for dental hygienists, recently surveyed its readers about instrument sharpening. 421 readers participated in the survey, and 40% sharpen instruments every day or at least once per week. We also asked dental hygienists about how often hand instruments are replaced in the offices where they work. This question was followed by another question regarding how often they would like to see the instruments replaced. As you can see from this slide, 20% say new instruments are purchased once a year. Obviously, a much higher percentage, at 44%, wish their offices would replace hand instruments on an annual basis. The survey also asked hygienists why instruments are not replaced as often as they would like. The cost of instruments and the current downturn in the economy were common explanations. The survey also asked hygienists about sharing setups with other hygienists in the office, as well as how they know when an instrument needs to be sharpened. Be sure to read the entire story in next week's RDH eVillage, which deploys on Friday, August 26th. Dr. Joseph Massad's column in Dental Economics is titled Tip of the Month. In his September column, Dr. Massad writes about flexible partial dentures. Earlier today in our studio, I talked with Dr. Massad about his column. Dr. Massad, I know you're often asked about the use of flexible partials in today's dental practice after your lectures. What are the benefits of using them?
Well, first of all, let me state that many doctors are afraid to use them. And I think, you know, maybe there's some justification for their fear, because what they're fearful about is that flexible partials flex. So when you bite, you know, will it hold your bite, or will you actually bounce a little bit? However, there is a rationale and a purpose on when and when not to use flexible partials. And I think in dentistry today we need options, especially in this economic climate. We need to be able to offer our patients sometimes a segue from one type of dentistry to another. Now, partials in general, if you look at partial design, it generally should help support the teeth. Where flexible partial, basically, since it has a little bit of a spring to it, are the teeth supported. So that's the question, that's the fear, and a lot of dentists think, I'm afraid of telling when I'm using a flexible partial. However, I think it's fine depending on the particular patient And I think as long as we let our patients know that these are not permanent, these are really provisional and temporary things, and we want to hold you over. And I think morally, ethically, we have an obligation to our patients to help them, and not to say, if you don't have this X amount dollar partial, then I can't do it because it's, you know, not going to work. And I think that as long as we understand and as long as we design it correctly, now there is, you know, one design over another. I really advocate the design of a flexible partial to be more like a full type of removable prosthesis, where it's, you know, it fills the peripheral borders, you know, the vestibules, where it has additional support. And the flexibility is good in certain instances, especially if you have some undercuts or like little bony torus. You can generally be able to negotiate those a little bit easier. So there are patients who are not ready to have surgery done. They're, you know, you don't want to leave them without multiple teeth. Then we have other complications. So I think in different instances, I think that we can have justification as long as we inform the patient, you know, these could break and they're very difficult, and sometimes we can't fix them because of the bonding strength. Now they are improving that, but you know, they are popular with patients, which is interesting because I actually survey dentists who are doing these, and they say our patients just love them. So why? Well, it's comfortable, and maybe before they had something more rigid that maybe wasn't designed as well. So even a properly made partial with the metal type, with metal clasp, okay, which, you know, goes by the standards. Sometimes if they're not made exactly because they're more precise, patients do have difficulty with them, okay. And so the flexible partials actually gives you some play, good, bad, and the ugly, but you have to take it for what it's worth. And so I like to tell patients, you know, we're going to segue you in from, you know, maybe losing multiple teeth. We're going to put something in that, you know, will work economically. And I think this will help you at this point in time, and we're going to have to now have a plan to where we're going to change this into either an implant or maybe another type of partial which has, you know, more support for the teeth. And let them know that this is something that, as long as they understand, that we feel like it should be changed, okay, and they know about the consequences if there's breakage. Now, but patients will say, I like it. Now, does that mean it's going to, you know, be good for the patient? Not necessarily, if they abuse it or if they never come back. Okay, now we have an obligation to at least inform the patient, seek out the best we can for a patient. But what if they came in and says, you know, I just can't right now. I've got 4 kids, wife, you know, doesn't have a job, and, you know, right now I don't want to go toothless like this. What can I do? You know, a lot of things have gotten kind of popular, like even the snap-on smiles have gotten popular because it's just something to fill in and give you a little bit of dignity back. So I like to think of a flexible partial as actually being a little bit more supportive than maybe just something that snaps on, because it can engage the tissues correctly, and if made properly, you know, these have been, at least patient satisfaction has been very high. And then I haven't really seen studies where it shows that it has been detrimental as of this point. I think in dentistry we have to go by principle. Even though this may not follow the you know, the dogmatic principle that is there, I believe as long as we use it like any provisional, then I think it could benefit many people today.
Okay. Are there any other patient benefits that practitioners should be considering?
Yeah, you know, if you think about it, a patient comes in and they're missing maybe 3 teeth and they've lost their self-esteem. One of the biggest benefits, I may have mentioned this earlier, but even to emphasize it even more, can you imagine when you put something in their mouth and all of a sudden you've restored the missing teeth, and you can imagine how maybe they'll be a better candidate to get a job now because they feel better about themselves, and they're not going to go holding their hand around and be afraid. And so what we could do for that patient is, look, we're going to give you just a temporary facelift, and then you don't really, in most of these flexible cases, you don't need to do surgical procedures to alleviate the path of insertion if there is some you know, curves in the bone that would not really take a normal type of harder type of plastic prosthesis. And if you have enough natural dentition, then generally the other dentition will hold itself. On the opposite of that, if you don't have but just a few teeth, then I think it should be used really to aid the patient, help the patient feel better about themselves. help stabilize them until they're at a point where we can now transfer them into something more permanent. And I think we have to think of dentistry as more fixed than permanent, because life itself isn't permanent. So all dentistry has to be changed in time. So I think the watchful eye of a good practitioner, and those that I see all the time at my presentations, I think they have good, honest opinions and faith that they're going to do something good for their patient, and that they have informed their patient that, you know, I want to take you into something at some later date as soon as we can, and maybe they'll have to replace that particular flexible partial. But you know, the cost factor of a flexible partial, compared to the metal clasp with the acrylic pads, which are conventional type partial, okay, or even the precision type partials, is significantly less. Less for the patient, it takes less time for the dentist, and I think as long as we inform our patients that this is something that I would going to put in as a temporary for you, then, and sometimes those temporaries may be a year or so, but you know what, at the end of the day, it's what can you do for what you were trained to do. You were trained not just to be a dentist, you know, with the cash register. You've been paid to take care of society. So we have to look at things that maybe are not as conventional, but look at them in a way that, right now, let me do something for you. I can do it for a lesser cost, as long as you understand that I'm going to be able to replace this later. I think so. You add all those benefits together. You have economics, you have self-esteem, getting a better feel. They go out and they're be interviewed for a job, and we did one for a patient recently, and she was getting ready to go interview for a job, and that's why she wanted it. I said, great, then this is perfect. Now you'll come back. She says, yes, I'll get dental insurance, and I want to have those implants and some caps done. I said, okay, and we'll do our very best. And I let her know that not all insurances pay for implants. However, we could put her in a more stabilized partial at some future date. So I think if we look at the whole realm of things and not just look at one item, I think it gives us a broader opinion and actually lets us feel better about it. I don't think dentists ought to be afraid of it, as long as they understand it, you see, as long as they explain it to your patient, and as long as they have a watchful eye on their patients.
Thank you for sharing that useful information with our readers. Be sure to look for Dr. Massad's article in the upcoming September issue of Dental Economics. Thank you for joining us on DentistryIQ.com. I'm Heather Walke saying goodbye until next week.